Hi, my name is Kennedy Sexton, and today I'm going to be demonstrating a sterile dressing change procedure. Before I start this, I would make sure during this whole skill video to follow all GPSP practices and principles. I would follow my 11 routes of medication administration, and I would do my 3 checks if I was giving any medication to my patient. So we're going to go ahead and get started. Hi, my name is Kennedy. I'll be your nurse today. I'm going to be doing a wound change on your incision. Is that okay? Perfect. Can you tell me your name and date of birth? Name and date of birth matches the wristband. And do you have any allergies I need to know about? Perfect. And I seen on your medication record that you had pain medicine about an hour ago. Can you rate your pain for me from a scale of 1 to 10, 10 being the worst? Okay, they tell me that their pain is at a 2, so it's manageable, and so it's okay if we go ahead and get started? Perfect. We're going to go ahead and get started. First off, perform hand hygiene. I'm going to don clean gloves. We're first going to remove the old dressing. So I'm going to take this off using the push and pull method. And if it was giving me any trouble or if it was stuck to the skin, I could use sterile saline to help get it off of the skin and not cause any farther harm to the skin. So now I'm assessing the old drain or the old bandage. I'm looking at the type of drainage, the amount, the color, if there's any odor, how much is there, if it looks normal, abnormal. And I'm also going to assess the wound. I'm looking for any pain, the size of it, if it's gotten any bigger, any smaller, the width, the type of drainage coming out of it, if the patient's in any pain around this site right now, and if there's any abnormal swelling, any abnormalities. So I'm going to throw this away. Off my gloves, hand hygiene. So now we're going to get into putting the actual sterile dressing on the wound. First, I'm going to, I've got my stuff set up here. My dressing change tray, it's in good shape. It's within the expiration date. There's no cracks, rips, tears, water, anything on the tray, so it looks good and sterile. I'm going to go ahead and open it. Perform hand hygiene again. And now we're going to don sterile gloves. Now that we have our sterile gloves on, we're going to go ahead and start cleaning the wound. Got my sticks, sterile cleaning sticks, and I'm going to clean the wound from top to bottom and the middle first. Top to bottom, the outside.
Buddy said, don't do it.
Now I'm going to take the same amount of gauze pads that I had to clean the wound, so I'm going to need 3. I'm going to take my first gauze, let it dry. I'm going to take my second gauze, and the third. Now that the wound is clean, I'm going to take these gloves off. For hand hygiene. And we're now going to don our second pair of sterile gloves. So we can put the new sterile dressing on the wound.
That's crazy. Yeah. Yeah. So they want you to use saline. Yeah.
asking like how long
That's good.
they said they're gonna use it as a teaching thing, because yeah, maybe there'll be somebody else in the future that has to go somewhere. It was
Now that we have our second pair of sterile gloves on, we're going to apply the sterile dressing to the wound. Now we've got our sterile tape.
now look at it. Pick it up. Put it back. Come back forward.
Now that my tape is applied, I would make sure to put my initials and the date and time on the tape. And perform hand hygiene again. I'd make sure my patient has their call out and the bed is in closed position with the bed wheels locked, and I would report my findings and procedures immediately.